Somewhere between your 60th and 65th birthday, a silent transition occurs within your cells that most people never truly realize is happening. It is a quiet, invisible shift in your internal chemistry. Imagine waking up on a Tuesday morning just like you have for decades. You go to the kitchen, pour a glass of water, and swallow the same small pill you have been taking for years. To you, nothing has changed. The bottle looks the same, the dosage is identical, and your routine is undisturbed. But deep inside your tissues, the story is radically different. Your body is no longer receiving that medication the way it did 10 or 20 years ago. The rules of engagement between your biology and your pharmacy have been rewritten. What was once a life-saving shield or a simple remedy for discomfort can, after the age of 60, begin to behave like a slow-acting toxin. Not because the medicine is bad, and not because you are frail, but because your body's internal operating system has reached a new chapter. This is the danger of the silent threshold. In the medical world, we often see patients who are doing everything right, yet they find themselves in the emergency room following a sudden stroke or a heart attack that seemingly came out of nowhere. When we look closer, we often find that the culprit wasn't a new disease, but a legacy medication, something they had been taking for so long that they stopped questioning it. In some cases, this chemical mismatch is the difference between a long, vibrant retirement and a sudden, catastrophic cardiovascular event. The most terrifying part is that there is rarely a warning sign. You don't feel the slow buildup of pressure in your arteries. You don't feel your kidneys struggling to filter out a surplus of chemicals. You just feel normal until the moment you don't. My name is Dr. Sage Sr. I have spent my career studying how the human body evolves as we age and how we can optimize our health to match our current biological reality. My goal on this channel is to strip away the medical jargon and provide you with clear, high-stakes information that helps you protect your future. Today, we are going to expose 5 specific types of medications that undergo a dangerous transformation once you cross the age of 60. One of these medications is sitting in the medicine cabinets of nearly half of the American population over 65. It is taken daily, trusted implicitly, and almost never reevaluated. But current evidence suggests that for millions of people, this daily habit is no longer providing protection. It is providing a direct path to internal injury. Before we dive into the specific drugs, we must first understand the fundamental shift in your biology. Because once you understand the why, you will never look at your prescription bottle the same way again. To understand why a routine medication suddenly becomes a cardiovascular risk, we have to look at what I call the biological software update. As we move past 60, our body's infrastructure begins a process of streamlining. It becomes more specialized, but also less forgiving. There are 3 major systems that change how they handle chemicals, and together, they create a phenomenon known as bioaccumulation. First, let's talk about your filtration system, the liver and the kidneys. Think of your liver as a high-end chemical processing plant. In your 30s and 40s, this plant operates at maximum capacity, breaking down medications quickly and efficiently, but as we age, the blood flow to the liver decreases. The enzyme systems, specifically those like the cytochrome P450 pathway, become less active. This means that if you take a pill at 8 a.m., a significant portion of that drug is still circulating in your blood at 8 p.m. Now add the kidneys to the mix. Your kidneys are the ultimate precision filters. Over time, the rate at which they filter waste, known as the glomerular filtration rate, naturally declines. When your kidneys slow down, medications stay in your system longer than the manufacturer intended. This is where the math becomes dangerous. If the drug hasn't fully left your system before you take your next dose the following morning, you aren't just maintaining a level, you are building a surplus. Over weeks and months, a standard moderate dose can effectively become a high dose or even a toxic dose without you ever changing the number of pills you swallow. The second major shift is in your vascular compliance. Your arteries are not just hollow pipes, they are dynamic, living tissues. In your youth, they are flexible, expanding and contracting like high-quality rubber bands to accommodate changes in blood flow. After 60, these vessels naturally become stiffer. The inner lining, called the endothelium, becomes more sensitive to chemical stress. When a medication causes even a tiny amount of fluid retention or a slight constriction of the vessels, a younger body absorbs that stress without issue. But in a body over 60, That same minor shift can send blood pressure spiking or put a dangerous strain on the heart muscle. Finally, we have the change in tissue sensitivity. Our receptors, the little locks on our cells that the medication keys fit into, change their behavior. In many cases, our hearts and brains become more sensitive to certain drugs, while our systems for maintaining balance, like our heart rate variability and our blood clotting mechanisms, become more delicate. This is why context is the most important word in medicine. A prescription is not a permanent decree. It is a snapshot of what your body needed at a specific point in time. If that prescription was written 5, 10, or 15 years ago, it is based on a biological version of you that no longer exists. We are often told that we need to stay on our medications to stay safe, but we are rarely told that safety is a moving target. When you layer these biological changes on top of medications that affect blood pressure, heart rhythm, or fluid balance, you create a perfect storm. It is a gradual accumulation of stress that pushes your cardiovascular system closer to its breaking point every single day. This is not about fear. It is about recognizing that your 60s and 70s require a different strategy than your 40s and 50s. We are now going to look at the first two groups of medications that exploit these biological changes. These are drugs used for pain and digestion, things we often consider to be minor or routine. But as you will see, their impact on an aging heart is anything but minor. Moving forward, we will see how these common pills can quietly hijack your blood pressure and your heart's essential mineral balance. Let's begin with something that is likely in your cabinet right now. You might know them as ibuprofen, naproxen, or perhaps a prescription strength version for your back or knees. These are non-steroidal anti-inflammatory drugs, or NSAIDs. For a person in their 40s, these are often seen as the ultimate tool for staying active. But after 60, these medications stop being simple tools and start acting as physiological disruptors. To understand why, we have to look at a microscopic messenger in your body called prostaglandins. Prostaglandins are fascinating molecules. When you have an injury, they signal pain and inflammation. NSAIDs work by shutting these messengers down, which is why your headache or joint pain vanishes. However, prostaglandins have a second, much more vital job in an aging body. They act as the safety valves for your kidneys. In a body over 60, the kidneys often require these prostaglandins to keep the blood vessels inside the kidney open and dilated. This ensures the kidney gets enough blood to do its job. When you take an NSAID, you aren't just blocking pain in your knee, you are inadvertently closing those safety valves in your kidneys. When the kidneys detect this drop in blood flow, they enter a state of panic. They assume your blood pressure must be too low, and they respond by triggering a hormonal cascade that tells your body to hold on to sodium and water. This is what I call the silent inflator. You might notice a bit of swelling in your ankles or a slightly tighter fit for your rings, but what you don't feel is the increased volume of blood now pushing against the walls of your arteries. Because your arteries are already less flexible after 60, this extra fluid volume translates directly into a spike in blood pressure. In the medical community, we call this subclinical hypertension. It is a rise in pressure that is often just enough to cause damage over time, but not always high enough to trigger an alarm during a 5-minute checkup. This persistent hidden pressure creates microscopic tears in the lining of your blood vessels. Your body tries to patch these tears with cholesterol and plaque, which is the foundational process of a heart attack or a stroke. Many seniors fall into the weekend warrior trap. They want to remain active, they want to garden or play golf, so they take these pills daily to manage the resulting aches. They feel they are doing the right thing for their health by staying active, but they are unknowingly trading joint comfort for cardiovascular strain. Studies have shown that frequent use of these drugs in older adults is associated with a significantly higher risk of a first-time heart attack. The relief is instant, but the physiological debt is cumulative. The second group of medications is even more deceptive because they are often taken to protect you. These are proton pump inhibitors, or PPIs, such as omeprazole or esomeprazole. Millions of Americans take these for acid reflux, heartburn, or to protect the stomach from other medications. They are incredibly effective at shutting down acid production, and for short-term issues, they are invaluable. The problem arises with what I call the legacy prescription. I see patients who were started on a PPI 10 years ago for a temporary bout of reflux, and they simply never stopped. They believe that because these drugs are available over the counter, they must be as safe as a multivitamin. But your stomach acid is not a mistake of nature. It is a critical component of your cardiovascular health. Stomach acid is the primary key that unlocks nutrients from the food you eat. Specifically, you need that acid to absorb magnesium, calcium, and vitamin B12. When you suppress that acid for months or years, you begin to develop subtle but dangerous nutrient deficiencies. Let's focus on magnesium. Magnesium is the mineral that regulates the electrical stability of your heart. It keeps the heart's rhythm steady and predictable. As we age, our magnesium levels already tend to drift lower. When you add a PPI into the mix, you are essentially cracking the foundation of your heart's electrical system. This leads to an increased risk of palpitations, atrial fibrillation, and other arrhythmias that can lead to a stroke. Furthermore, recent research has suggested a more direct link between PPIs and vascular aging. It turns out that the same proton pumps that produce acid in your stomach also exist in the cells that line your blood vessels. By shutting these pumps down globally, you may be unintentionally accelerating the aging of your arteries, making them less able to clear out waste and more prone to stiffness. People rarely connect their heart palpitations or their fatigue to an acid reflux pill they've taken for a decade. But medicine is an interconnected web. When you change the chemistry of the stomach, you change the chemistry of the blood, and eventually you change the performance of the heart. Before we move on to the final medications, we have to address the most complex risk factor of all: polypharmacy. This is the medical term for taking multiple medications at once, and it is the reality for the vast majority of Americans over 60. The danger isn't just in the individual pills, it's in the chemical conversation they are having with each other inside your body. Think of your body as a precision engine. Each medication is an adjustment to that engine. If you make one adjustment, the engine can adapt. But if you make 5 or 6 adjustments simultaneously, the engine's internal logic begins to break down. A classic and dangerous example is the interaction between an NSAID for pain and a daily aspirin for heart protection. Many people don't realize that common pain relievers can actually block the heart protective effects of aspirin. If you take an ibuprofen in the morning for your back and then take your baby aspirin, the ibuprofen can physically block the aspirin from reaching the platelets it's supposed to protect. You think you are protected from a heart attack, but in reality, you have the side effects of both drugs and the benefits of neither. Then there is the prescription cascade. This happens when a doctor prescribes a medication to treat the side effect of another medication without realizing it was a side effect. For example, a patient takes an NSAID for joint pain. The NSAID raises their blood pressure. The doctor, seeing the high blood pressure, prescribes a new blood pressure medication. Now the patient is on 2 drugs with twice the potential for interactions, and the root cause, the NSAID, is still there, quietly causing damage. This is why, as we age, we must move away from the idea of more is better. In your 60s, the most powerful thing a doctor can do for you is often not to add a new pill, but to carefully and safely remove or adjust the ones you no longer need. We have been conditioned to believe that every symptom requires a chemical solution, but after 60, the best solution is often a simplified regimen that honors the way your body actually functions today. Coming up, we are going to look at the medications that affect your nervous system and your breathing, and then we will reveal the truth about the one medication that has undergone the biggest medical reversal in recent history. It is the pill that millions take as a preventative measure, but for many, it has become a hidden liability. As we move deeper into the complexities of health after 60, we encounter 2 groups of medications that are often used to manage the common friction of daily life: stress, poor sleep, and seasonal allergies. While they seem like simple solutions to uncomfortable problems for a cardiovascular system in its 6th or 7th decade, they can act as a sudden and heavy weight. First, let's discuss benzodiazepines. These are medications like diazepam or lorazepam, often prescribed for anxiety or as a sleep aid. Many people find them essential for navigating the stresses of aging or the insomnia that often comes with it. But in an older body, the central nervous system is far more sensitive to these chemicals. They stay in the fat tissues and the bloodstream much longer than they did in your youth. The danger here is what I call cardiovascular stasis. Because these drugs are so effective at slowing the brain, they also slow down the body's physical movement. After 60, your circulation depends heavily on movement and the contraction of your muscles. When you are overly sedated, your blood flow becomes sluggish. This increases the risk of deep vein thrombosis or blood clots that can travel to the lungs or brain. Furthermore, these medications can significantly alter your breathing patterns during sleep. Many seniors have undiagnosed sleep apnea, where breathing stops and starts throughout the night. Benzodiazepines deepen this effect, leading to longer periods of low oxygen. Every time your oxygen level dips, your heart has to pump faster and harder to compensate. You wake up feeling tired, but your heart has essentially run a marathon while you were asleep. Over time, this nightly stress can lead to heart failure or a sudden rhythm collapse. Then we have the decongestant trap. When allergy season hits or a cold sets in, many people reach for over-the-counter medications containing pseudoephedrine. These drugs are stimulants. They work by constricting blood vessels to reduce swelling in your nose. The problem is that these drugs are not targeted. They constrict blood vessels throughout your entire body. For a 30-year-old with flexible arteries, this systemic constriction is a minor inconvenience. But for someone over 60, whose arteries are already stiffer and perhaps narrowed by plaque, this is like putting a kink in a garden hose while the faucet is turned on full blast. It causes an immediate sharp spike in blood pressure and forces the heart to work against massive resistance. For an aging heart, this liquid stress can be the final trigger that causes a weakened vessel to fail. Over-the-counter does not mean safe. It often means user beware. We have now reached the most controversial and perhaps the most important part of our discussion. It concerns a medication that has been the cornerstone of heart health for nearly half a century. Low-dose aspirin. For decades, the advice was simple. If you want to prevent a heart attack, take a baby aspirin every day. It was seen as a cheap, easy, and harmless insurance policy. But medicine is a living science, and in the last few years, the data has shifted in a way that has surprised even many doctors. Major medical organizations, including the United States Preventive Services Task Force, have significantly changed their guidelines for adults over 60. The core of the issue is the balance of risk. Aspirin works by making your platelets less sticky, which prevents clots from forming. This is excellent for preventing the type of stroke caused by a blockage. However, as we age, the walls of our blood vessels and the lining of our digestive tract become more fragile. The same property that prevents a clot also makes it much harder for your body to stop a bleed. For many adults over 60 who have never had a heart attack or a stroke, what we call primary prevention, the risk of a major internal bleed now outweighs the benefit of clot prevention. We aren't just talking about a bruised arm. We are talking about life-threatening bleeding in the stomach or, more dangerously, a hemorrhagic stroke, which is bleeding inside the brain. This is a profound medical reversal. Many people are still taking daily aspirin because they started 10 or 15 years ago and were never told to stop. They believe they are being proactive, but in reality, they may be walking a tightrope without a net. Now, I want to be very clear. If you have already had a heart attack, a stroke, or have a stent, aspirin is often a vital, life-saving medication. This is called secondary prevention, and in that context, the benefits are still very high. But if you are taking it just in case, or because you heard it was good for you years ago, it is time for an urgent conversation with your physician. Your biological context has changed, and your preventative strategy must change with it. We have covered a lot of ground today, from the way your liver and kidneys handle chemicals to the hidden dangers and common pain and stomach medications. It can feel overwhelming, perhaps even a bit frightening. But the goal of this information is not to cause fear, it is to give you back the steering wheel. The most dangerous thing you can do after watching this is to suddenly stop your medications on your own. That can cause a rebound effect that is often more dangerous than the medication itself. Instead, I want you to conduct what I call a medicine cabinet audit. The next time you sit down with your doctor, don't just talk about new problems. Bring all your bottles, including the vitamins and the over-the-counter pills, and ask the golden question, Dr. Sage, considering my age and my health today, is every one of these still serving me? Is the benefit of this pill still greater than the risk it poses to my heart and my brain? That one question changes you from a passive passenger to an active pilot of your health. It triggers a review process that can lead to a simplified, safer, and more effective health plan. Your body after 60 is a masterpiece of adaptation. It has learned how to maintain balance through decades of challenges, but it needs you to be its advocate. It needs you to recognize that more is not always better, and that the best medicine is the one that is perfectly matched to who you are right now, not who you were 20 years ago. If you found this explanation helpful, please share it with someone you care about. Many people are living on medical autopilot, and a single piece of information like this can be the catalyst that prevents a tragedy. My name is Dr. Sage Sr. Thank you for spending this time with me. Stay informed, stay proactive, and remember that your health is a journey of constant refinement. I will see you in the next video.